Welcome to NSG 222, Study Section 9, Altered Immune Response. Introduction. The main goal of immune response is to protect against the presence of foreign antigens. This response may be excessive, overreaction, or the body may fail to maintain self-tolerance, and this results in tissue damage. This is termed a hypersensitivity reaction. A type of hypersensitivity response occurs when the body fails to recognize self-proteins and react against its own protein. The diseases that occur as a result of immune responses against self-antigens are termed autoimmune diseases. In this study session, the different types of altered immune response shall be discussed. Learning outcomes. At the end of the study session, you should be able to 1. Highlight the different types of hypersensitivity reactions. 2. Explain nursing assessments in allergic and hypersensitivity reactions. Hypersensitivity reactions. Over-responsiveness of the immune system to an invading organism or foreign protein is termed hypersensitivity reaction. This is classified according to the source of the antigen, time sequence, immediate or delayed, or basic immunologic mechanisms causing the injury. There are 4 types of hypersensitivity reactions. Types 1, 2, and 3 are immediate and are examples of humoral immunity, while type 4 is delayed hypersensitivity reaction. Type 4 is related to a cell-mediated immunity. Summary of types of hypersensitivity reactions. See table. Let us examine in detail the types of hypersensitivity reactions. Type 1. IgE mediated reaction. Anaphylactic reaction. This type of reaction occurs in susceptible persons who are highly sensitized to specific allergens. On first exposure to the antigen, the body produces IgE antibodies in response to the allergen. This immunoglobulin attaches to the mast cells and the basophils. Within these cells are granules containing potent chemical mediators, histamine, serotonin, slow-reacting substance of anaphylaxis, SRSA, eosinophil, chemotactic factor of anaphylaxis, ECFA, kinase, and bradykinin. On a subsequent exposures, the allergen links with the IgE bind to mast cells or basophils and triggers the granulation of the cells and the release of chemical mediators from the granules. The reaction occurs in minutes or hours and is usually not dangerous. An example of a will and flare reaction is the mosquito bite. The will and flare reaction serves as a diagnostic purpose as a means of demonstrating allergic reactions to specific allergens during skin tests. Common allergic reactions are anaphylactic shock, atopy. 1. Anaphylactic shock. This occurs when mediators are released systematically, for example, after injection of a drug or after an insect sting. This may be life-threatening and occurs within minutes, causing bronchial constriction, airway obstruction, and vascular collapse. At first, the symptoms may include edema and itching at the site of the exposure to the allergen. Further manifestations which suggest systemic effect include rapid shock with rapid but weak pulse, hypotension, dilated pupils, dyspnea, and possibly cyanosis. This is compounded by bronchial edema and angioedema. Death may ensue if emergency treatment is not initiated. 2. Atopic shock. Atopy is an inherited tendency to become sensitive to environmental allergens. Common atopic diseases are allergic rhinitis, asthma, atopic dermatitis, urticaria, and angioedema. Type 2. Cytotoxic and cytolytic reaction. Type 2 hypersensitivity reaction involves direct binding of IgG and IgM antibodies to an antigen on the cell surface. Antigen-antibody complexes activate the complement system, which mediates the reaction. Cellular tissue is destroyed either by activation of the complement cascade resulting in cytolysis or by enhanced phagocytosis. This results in destruction of target cells such as erythrocytes, platelets, and leukocytes. Some of the antigens involved in type 2 reactions are the ABO blood group, Rh factor, and drug actins such as chloramphenicol. Pathophysiologic disorders characteristic of type 2. Reactions include ABO incompatibility, transfusion reaction, Rh incompatibility, transfusion reaction, autoimmune and drug-related hemolytic anemias, leukopenias, thrombocytopenia, erythroblastosis fetalis, hemolytic disease of the newborn, and Goodpasture syndrome. The tissue damage usually occurs rapidly. 3. Type 3 immune complex reactions. Type 3 reactions occur secondary to antigen-antibody complexes. In this case, soluble antigens combine with immunoglobulins Ig and IgM to form complexes that are too small to be effectively removed by the mononuclear phagocyte system. These complexes are therefore deposited in tissue or small blood vessels, causing the fixation of complement and the release of chemotactic factors that leads to inflammation and destruction of the tissues involved. Type 3 reactions may be local or systemic and immediate or delayed. However, it should be noted that the clinical demonstration is determined by the number of complexes formed and the locations. Common sites for deposits are the kidneys, skin joints, blood vessels, and lungs. Take 2. Common sites for deposit are the kidneys, skin, joints, blood vessels, and lungs. Severe type 3 reactions are associated with autoimmune disorders such as systemic lupus erythematosus, acute glomerulonephritis, and rheumatoid arthritis. Type 4. Delayed hypersensitivity reactions. This is a delayed hypersensitivity reaction, also referred to as a cell-mediated immune response. Normally, cell-mediated responses are usually protective mechanisms, but tissue damage occurs in delayed hypersensitivity reactions. It is important to note that the tissue damage in a type 4 reaction does not occur in the presence of antibodies or complements, but in the presence of sensitized T lymphocytes. These lymphocytes attack antigen or release cytokines, some of which attract macrophages into the area. The macrophages and enzymes released are therefore responsible for most of the tissue destruction. Delayed hypersensitivity response takes 24 to 48 hours for a reaction to occur, and examples include contact dermatitis, hypersensitivity reactions to bacteria, fungal and viral infections, and transplant rejections. Nursing assessments in allergic or hypersensitivity reactions. As a nurse, you are required to carry out a comprehensive assessment, including patient history, physical examination, diagnostic workup, and skin testing for allergens. 1. Health history. History of allergies in the family. Patient experience of past and present allergies to identify allergens which might have triggered the reaction, and social and environmental factors should be noted. Family history, including information about atopic reactions in relatives, is especially important in identifying at-risk patients. The specific disorder, clinical manifestations, and treatments prescribed should be assessed. Determine the time of the year in order to note seasonal allergies. Information should also be obtained about any over-the-counter or prescription medications used to treat the allergies. Social and environmental factors, particularly presence of pets, trees, and plants on property, pollutants in the air and floor coverings, house plants, and cooling and heating system in the home and workplace can provide valuable information about allergens. In addition, a daily or weekly food diary with a description of any untoward reactions is important. Of particular interest is a screening for any reaction to medication. Finally, questions about the patient's lifestyle and stress level should be reviewed in connection with the appearance of allergic symptoms. 2. Past health history. Recurrent respiratory problems, seasonal exacerbations, usually reactions to insect bites or stings, past and present allergies. 3. Medications, usually reactions to any drugs or medications, use of over-the-counter medication, use of medications for allergens. Functional health patterns, health perception, health management, family history of allergens, malaise, nutritional, metabolic, food intolerance, vomiting, elimination, abdominal cramp, diarrhea, activity exercise, fatigue, hoarseness, cough, dyspnea, cognitive, perceptual, itching, burning, stinging of eyes, nose, throat or skin, chest tightness. Role, relationship, altered home and work environment, presence of pets. Categories of allergens. See table. Physical examination. A head-to-toe physical examination should be conducted on patients with allergies. Attention should be focused on the site of the allergic manifestation. Observe the following. Integumentary. Rashes, including urticarial, weight and flare, papules, vesicles, bullae, dryness, scaliness, scratches, irritation. Eyes, ears, nose and throat. Eyes, conjunctivitis, lacrimation, rubbing or excessive blinking, dark circles under the eyes, allergic shiner. Ears, diminished hearing, immobile or scarce tympanic membranes, recurrent ear infections. Nose, nasal polyps, nasal voids, nose twitching, itchy nose, rhinitis, pale, buggy mucous membranes, sniffling, repeated sneezing, swollen nasal passages, recurrent, unexplained nose bleeds, crease across the bridge of the nose, allergic salute. Throat, continual throat clearing, swollen lips of tongue, palpable neck lymph nodes. Respiratory, wheezing, stridor, thick sputum. Possible diagnostic findings: eosinophilia of serum, sputum or nasal and bronchial secretions, elevated serum, IgE level, positive skin test, abnormal chest and sinus x-rays. Summary. In this study session, you have learned that 1. Over-responsiveness of the immune system to an invading organism or foreign protein is termed hypersensitivity reaction. 2. There are 4 types of hypersensitivity reactions. Types 1, 2, and 3 are immediate and are examples of humoral immunity, while type 4 is delayed hypersensitivity reaction. Type 4 is related to a cell-mediated immunity. 3. As a nurse, you are required to carry out a comprehensive assessment, including patient history, physical examination, diagnostic workup, and skin testing for allergens. 4. A head-to-toe physical examination should be conducted on patients with allergies. Attention should be focused on the site of the allergic manifestation. End of study session 9. Thanks for listening.